Week in Borough? Well, I think it's a unique opportunity to get different researchers from different fields of research, students, community members, decision makers in the local community together and exchange ideas. So the researchers can share their own knowledge and their research findings with the community, and the community can share their concerns and future research priorities with the researchers. So that's Science Week for me.
I think the value of international collaboration for us has been it's got us out of our small bubble. It gets us to think differently, to ask new questions, to have our ideas challenged. For our students, it's meant they've been able to see and ask the same questions of quite different places. And it's shaking them out of their comfort zone. Between our researchers, it means that they then think about the comparability of the work and the lessons that we can learn from each other. I think international collaboration is a place where we can innovate, where we can think about the future, and we can also learn to think and understand our own strengths. Through international collaboration, you understand and see your own work and the value that it provides, that it might not be always obvious when you're there all the time. But by going away and hearing inspiring stories, you'll start to see the strength in your own work. I know going and seeing Peter Berggren's work and saying where he said that we are the future. We are already there. We're the future that you will experience. It has completely changed the way we talk about ourselves and the way we see our work. Rather than coming from a point of deficit or weakness, we now understand where our strengths are and are able to articulate them.
A colleague asked if I would like to design a surgical bus for rural New Zealand. We started off with a surgical bus, which has been very successful so far, visiting rural New Zealand, doing low risk elective day surgery. I think the total is something over 21,000 patients so far, and I think we'd have to say it's done pretty well. And we picked on two things. You need more, but we picked on two. One of them was, if you need expensive equipment that you don't need every day, then obviously share it. Traditional sharing meant it went to one place in the country and everyone sent their patients there. Sharing mobile means that it comes to everyone's place. So video has a big place. I see rural towns and countries of the future really being very popular, because isolation is dealt with video, equipment is dealt with by sharing in mobile ways and other ways that we might think of in the future, and those two things will help in a lot of ways.
We've been seeing a big growth in telehealth in the last couple of years. We've seen technology get cheaper and get better, and we've been seeing increased bandwidth to different sites. So some of the initiatives in New Zealand that at the moment, there's a number of regions throughout the country. Each region implements a different solution, but we have seen some of those pulled together a little bit on a national basis.
So my research looks at university community engagement in small rural villages, or small rural communities we call them here in Australia. We're looking at 3 case studies of university ventures in small rural communities, so places of less than a few thousand people, and looking at the Mid-North Knowledge Partnership in Borough, the Northern Ontario School of Medicine in Canada, and the Centre for Rural Medicine in Sweden, and looking at trying to better understand the way these things operate and function and the impact they have on communities, and what we might be able to learn from them by through better understanding the value of research in places like these.
So I'm this medical intern, and I'm currently working at the Lycksele Lazaret, and I'm also doing PhD studies in a combined with my medical internship. It's been really interesting to meet other people that are in the same situation as I am, since I'm in the beginning of my PhD. We get to share our experiences, but also our problems, and it's really important that we get to meet each other to discuss these problems.
why should we collaborate internationally, it is because we all have bits of the puzzle and we all have different experiences, but by putting them together we can learn about human behavior. We can learn also about why patients, for example, are challenging because they don't do always what we tell them to do, and maybe also it is because we don't understand their living conditions. We don't understand perhaps the way they have been brought up and what they think is acceptable. And I think it's the same, I think, with health workforce issues. The challenges of rural and remote areas is because we have been educated as persons in we need to survive, we need to be resilient. So it's the whole game of winners and losers. But if you play the game to succeed and often we do that and we don't think about what that means to other people and if they lose out. And I think the challenge, I think, for us as health professionals as well is to create win-win situations.
So it's been a wonderful week, not just exchanging information amongst people, but actually starting some new projects. So we're bringing some of what was learnt in Recruit and Retain in Sweden to Australia. We're setting up a new project with our colleagues in New Zealand to look at the use of internet technologies in rural health. And we've just launched a new project looking at different models of primary care in the different countries. So I think what's great is that we don't just have people talking to each other, but actually doing work, and that's been the main outcome of the week.